3 sexually transmitted diseases surge for the 5th straight year, and the Centers for Disease Control says the U.S. is reaching a record number of cases.
And it also shows that Nevada is reflecting that trend. 8 News Now reporter Kristen Drummond shows us how the state ranks in the new health report.
The Centers for Disease Control and Prevention releasing the numbers this week, including a breakdown of each state. For the 2nd year in a row, Nevada ranks first in rates of primary and secondary syphilis.
Obviously, as a state, you would want to not have those kind of numbers, right?
It's just horrible. But what do we do about it?
A question for some people after learning the state's 2018 STD statistics.
Obviously, it's a concern, and obviously whatever we're doing is not enough.
We are reflecting the national increases across the board in chlamydia, gonorrhea, syphilis, and congenital syphilis.
CDC data shows nearly 1.8 million cases of chlamydia reported last year, the most ever for that infection. Gonorrhea and syphilis cases are also rising to the highest number reported in roughly 30 years.
We, like the rest of the nation, are working hard to kind of get those people treated and get those partners taken care of.
Kimberly Hurton with the Southern Nevada Health District says increasing access to testing remains a priority. Along with syphilis, data shows Nevada ranking 2nd in rates of congenital syphilis, a disease passed from an infected mother to her baby during pregnancy. The state does not make the top 10 for chlamydia or gonorrhea, but speculation remains on possible reasons for the STD increase.
We know that some of it could be attributed to more access to care and more testing.
Others blame accessibility for sexual encounters via apps or not taking the necessary precautions.
And this is all part of your health, and this is something you should be talking to your partner about, period.
In Nevada, pregnant women are required to test for syphilis during the 1st and 3rd trimester. Back to you.
The health district says it's piloting a self-collection project which would allow people to collect their own samples and not have to visit a doctor for testing.